Are you Mr. Newberger?
Yes.
I'm Dr. House. I need to ask you a few questions about your wife.
Is she gonna be okay?
I'm afraid I don't know that. Could you tell me about her accident?
They think she fell asleep, went off the road. That's all they told me.
Any problems with her health up until now?
Why?
Please, it's important.
She had a fever today, but otherwise she was
How high?
at 101. She hasn't missed a day of teaching in years. And I should have made her stay home.
Any other symptoms?
A stomach ache. Who cares? She was in a car crash.
Mr. Newberger?
Yeah.
My name's Ellen Stambler. I'm the organ procurement coordinator for Southern New Jersey. I just want to assure you that we'll treat her organs with care and dignity.
Her organs? Laura died?
I'm sorry. I thought, she was just pronounced dead. I thought he was telling you.
I didn't know. You should never make assumptions.
What did you want from me?
I'm sorry for your loss, but I need your wife's heart.
The organ procurement coordinator just left the hospital.
Means we got lucky. Either that or she's getting lunch. Dead woman's last name have a U or a W.
You're hacking into a confidential patient file?
No problem for you?
It's a U, N-E-U.
3 minutes ago, her organs were officially declared not viable. Time to go dumpster diving.
Hey, she's got hepatitis C. Her ALTs are 3 times normal. With Henry's immune system down, an infected heart will kill him.
Fortunately, she didn't have Hep C.
She tested positive.
Her history says otherwise. Her husband told me she was running a fever with stomach pain. It's not symptomatic of Hep C. Fever, stomach pain, raised liver enzymes.
She's sick.
Worse than that, she's dead.
My point is, even if it's not Hep C, it's something. They turned her down as a donor because if we put that heart into someone, they won't survive. Whatever made her sick will kill him.
Yeah. So what is it? The enzymes indicate
You want us to do a differential diagnosis on a dead person?
we're going to cure her.
We're going to cure death?
Doubt it. Just want to get the infection out of her heart before we get the heart out of her.
A sign of gallbladder infection, but there was a cyst.
Perfectly round. Now, Hep C
The
wouldn't
question
cause...
was never, is it Hep C? The question was, given that it's not Hep C, what is it?
Adenoma?
Not solid enough.
Cavernous hemangioma?
Not vascular enough.
What if she was sloppy about washing her hands after pooping?
Amoeba infection?
The antibiosis started in her liver and spread to her blood. That would explain all her symptoms, except for the crushed skull, but I'm assuming that's from the car crash.
I started her on paramomycin and chloroquine.
10 grams each.
That's 20 times the normal dose.
Right, so we'll destroy her retinas and damage her hearing. Whoever wants those parts is having a very bad day.
A couple hours on the meds, she's feeling great.
The heartbeat's irregular. Looks like local hypokinesis.
Stop the meds.
You're giving up?
Either we're wrong and her heart is unusable, or we're right. The treatment we had to give her will make her heart unusable. I'm sorry. You can pull the plug now. Find me another body. That fat guy on ortho service didn't look so hot.
No! She's not ready.
You were ready this morning.
She's not done. She's gotta save that guy.
Alternate theories?
Amoebiasis was our best hope. The fact that her heart rate went back to normal when we stopped the meds pretty much
What's our
confirmed.
second best hope?
House, put down the wand. There's no obstruction.
Maybe we should just biopsy it.
She's a fridge with the power out. We start poking around inside, the vegetable goes bad. No offense.
I don't see that we have a lot of choice. The only way we're gonna find that infection.
What if it's not an infection? Toxins can cause similar symptoms, especially if whatever it is did liver damage.
Her toxin screen was clean.
Those things never cover for any of the really cool toxins. Run the screen again for whatever you can think of. You keep the other patient alive. You check out the school. And they seem to need to hire another doctor to go search her home.
Diet pills could have messed her up, raised the liver enzymes and caused the bellyache.
Not the fever.
Maybe something else set off the fever.
Like what?
Before I show you these, they were in a locked drawer on her desk. The vice principal said that Laura must have confiscated them. They've had some problems.
Either interesting or helpful. This, at least, is interesting.
Well, it's not.
Sex with teenagers isn't interesting. Where did you grow up?
It isn't helpful. Teenage boys aren't toxins.
What if the cyst isn't a cyst?
And we have nothing to go on.
I said it's not a cyst. I didn't say it was nothing. What if it's a scar?
Fitzhugh-Curtis syndrome? Pushing gonorrhea again?
You got anything better? Test her and start her on ceftriaxone.
What are you testing for now?
Just some more infections. She's positive for gonorrhea.
I think that's the first time those words have been uttered in joy.
Meds are started. Her heart should be clear enough to use in about 4 or 5 hours. I'll go tell the families.
He's in a coma.
Start him on dobutamine.
Already did. We either do the surgery now or we find him a new brain, too.
House, she's still got a significant amount of gonorrhea in her system.
Hopefully tomorrow, it'll be in his system. I need 2 ORs and the transplant team.
What is it?
What's going on? Is he getting a heart?
I assume this means you found out what was wrong with Laura.
She had immune biases. We just found a different way to get rid of it.
Thank you.
That was kind of you.
I didn't want him going postal on us. As soon as his wife's heart's in our hands, we can tell him about the gonorrhea. He's got to be tested, preferably before he gets any sympathy sex.
Mr. Newberger, there's something I need to tell you.
For the last year or so, Laura was kind of distant with me. I don't know why. I thought maybe she was having an affair, but not Laura. And I'm not excusing myself, but when I was traveling during Christmas, I had a one-night stand. I got gonorrhea.
Are you sure?
Yeah. I should have said something to you. But I didn't want to believe that I gave it to her. That's what made her sick, and that was why she got into the accident.